I try to listen to the patient and imagine what's going on in their life besides the skin.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar. You know, it's another podcast time, and I've just been thinking a lot about rosacea. What about you?
Yeah, we see a lot of skin conditions. Obviously, rosacea is a very common one and troubles a lot of our patients. And we have some standard therapy. We're really big at LearnSkin about integrative approaches. But really what's cool is when you start to combine all these together and try to see what kind of benefits you can really squeeze out for your patients. Because we have effective topical therapies. We have some other interventions for rosacea. But sometimes kind of combining everything together, really tailoring it to the patient in front of you, gets great results for your patients, but also satisfaction for you as a master. So I was thinking maybe we can bring someone who's trying to master all these skills and blend them together just for rosacea patients. What do you think?
I think that's exactly what we need. And I think the integrative conversation is pretty much the brand of LearnSkin, right? Like we will talk about anything and everything, but being able to do it all in one conversation is really important. And we're lucky today because we have Dr. Martha Viera, who heads Martha Viera Dermatology. She's an integrative dermatologist and also an aesthetic dermatologist. And she graduated from the University of Miami School of Medicine.
Woohoo!
She's your alma mater, my friend, and same as you. And she's also from Venezuela, so she has that international perspective on just how we do things here. Martha, we are super excited to have you. And also, you were a graduate of the Integrative Dermatology Certificate Program from 2022 to 2023. So you really started to delve into how to do the integration at its fullest potential that we always talked about. And we want to hear about how you're doing it. So Martha, welcome to the podcast.
Thank you. Thank you so much. I'm super excited to be here. And thanks to you, the LearnSkin and the IDS opened a little bit more my mind to this integrative approach. So I'm very excited.
Yeah, I think one of my favorite thing is to see seasoned clinicians actually come in and take it in, something that they really wanted to do for a long time. But I want to put words in your mouth. But maybe you can tell our listeners what made you pivot, because you've been practicing before this, right? You joined the certificate program, started going to IDS. It's probably part of a bigger change, right?
100%. So, a lot of our conditions in skin and dermatology could be frustrated for the patient and for us. And I've been looking for, other ways to see and to approach these conditions. Sometimes you give a patient an antibiotic for 3 months and then the patient is great. And then they come back 5 months later and say, listen, I'm back where I was before, even worse. And then you kind of get frustrated with them. And then you go to that vicious cycle. So for a long time, I was trying to see what the functional approach I can, integrating nutrition and other aspect of the medicine that we can add to our armamentum, but I wasn't quite clear of how to do it. So that's why I was very interested to dig in a little bit more. And rosacea is one of the conditions that is always interesting me because I do lasers, I do a lot of cosmetic procedures, and I saw my patients get better with the combination, but not quite there. And sometimes I needed to stop the antibiotic before I do the laser. So it was a very kind of vicious condition for me to treat. And the patients were never 100% clear when they went back to baseline.
Yeah, and especially in Miami, I can tell you, folks who are listening are not in Miami, but maybe in California as well, I'm sure, where the sun shines, rosacea can be really, really tough. But before we get into rosacea, I want to harp on one more point in kind of our introductory section, if you will, because Martha, you mentioned that you for a long time wanted to kind of get this together. You sought out some training trying to bring this together. And I think definitely we'll go over the results for your patients and what you do in just a bit. But we find that a lot of times clinicians for them, the integrative journey is also a self-healing process or something that they see fruits in their own lives for it. Has that been true for you?
Well, yes, we have a family event actually with my husband, and we needed to change our whole perspective of our diet. He went through, a cancer. So we have to do like an epigenetic program for 8 months after he finished his chemotherapy and, all the treatment, Western treatment for that type of cancer. So when we went through that, I was actually before that very into and very strict with nutrition in my house and personally, but he didn't. So he saw the important aspect in our health to integrate nutrition into our, daily food as medicine. So he did like a 9 months of a regimen with a nutritionist. He changed all his habits. He was a person that he would be an athlete, but he would take 2 liter of Coke and Chips Ahoy's, and he would love McDonald's, which I was after him, please don't do that. And then after he had this episode, I was like, okay, please listen to me. That your body's asking you for this. So in our house, I was doing it already. I was doing detox for sugar every 3 months. I was doing my routine, my exercise. He got into that, and either my kids, they're not orthorexics, but they read the labels and they say, oh mom, this has more than 5 grams of sugar and stuff like that. So for us, it's like it was a game changing he saw that aspect of health and nutrition and integrated with exercise, sleep, and the whole circadian rhythm to have good lifestyles and good habits. For me, it was like a wake up call for him, but for me, it was a certain that this needs to be part of our day to day and to apply it in our treatments as well. Because as you said, in Miami, we have the sunshine, but we also have spicy food, or we have different things, epigenetic things that we see in our conditions such as rosacea and acne or other conditions. So I've been seeing that and because of that, I got very interested and see how other tools can I use for my patients.
I really love this. I think taking the journey inspired by, rather tragic event and bringing it together and actually bringing the whole family together as you have. What a double win, right? Both your husband, who I hope still remains healthy and doing great, but also
Yeah.
the whole family and now your practice. And I find that it's really true when you try to introspect, look at your health as well. You actually, as a clinician, do better for your patients because you know where they're coming from, if that makes sense. And that's how it works for me as well. So that's another beauty of integrative medicine where you can really look at the whole of a person. If I had to look just at my skin, and my skin problems would have been rather boring clinician, but actually introspecting about my health and then my patient's health overall really brings it all together. So with that in mind, let's look at rosacea and tell those cynics out there, what do you see when you see rosacea that makes you think, oh, there's a lot of room for integrative medicine here?
Oh, yeah, it's exciting. I listen to the patients. I always ask things that I didn't ask before, and I call it reductionism. Like when we focus only the skin, you need to go inside and kind of start like scanning your patient as the patient talks. So I ask the patient if they're stressed, what's their lifestyle, what do they eat, how they're sleeping, because I want to see how they're managing their circadian rhythm, how they're sleeping, what's the stress level. Because as we know, in rosacea, we have a lot of neurogenic inflammation, neurogenic pathways, angiogenesis from inflammation that can be triggered from all of these, even cortisol. And we'll talk about that more. But I ask the patient if they have any GI symptoms, if they have a very popular pustular rosacea, or sometimes erythematous rosacea, I haven't seen much of a relationship with the gut skin axis, but I still ask them. Even if they don't have those extreme of symptoms, if they have, oh, I have heartburn, or I have, abdominal distension, I have dyspepsia, or like I can't digest well, or I have different intestinal habits, or, diarrhea or constipation. So I try to listen to the patient and imagine what's going on in their life besides the skin. And that gives me a lot of information. I have actually a questionnaire that kind of filter what I want to get. And then most of the time gives me the diagnosis, even without doing any test or anything further. And the patient likes that. The patient feels understanding. The patient feels like, oh, this doctor listens to what I have to say because they think I'm crazy. This doctor, oh, I tell them, listen, your rosacea flares up when you're stressed. Oh my God, yes. Okay, yes, you have your cortisol is like to the roof, or maybe your adrenal, glands are shrinked because you're overusing them, and the cortisol also leads to leaky gut, and you're eating 5 times a day, and that gives you a SIBO, stuff like that. So once you start listening to your patient and kind of connecting the dots, then you can help them more.
Well, Martha, I have to say, this is one of the key tenets of being integrative. First of all, thanks for sharing the journey on your own approach with your health, because I think it drives this sort of an approach when you're starting to think about rosacea, because you start realizing there's so many variations in rosacea, isn't there, Martha? Because now you
Yes.
start seeing that it's not just whatever we see as a symptom. There's like, well, how much of the gut is involved? How much of this is related to sun exposure? What about the foods that they're eating? What about the different triggers with stress? So there's so many facets to this. And then that brings in the question, how do you approach understanding the different sort of influences that are there? And maybe we start with the gut. How do you approach gut assessments and gut testing? What are some of the things that you talk through when it comes to rosacea? What are the things that we now know with rosacea?
So there are a lot of like evidence right now. There are rosacea associated with some of the, gut or intestinal conditions like IBS or, Crohn's disease or, chronic gastritis with the Helicobacter pylori. So I started kind of learning. I have done more than 30 patients or about 30 patients over these past 10 months after I graduated. Almost a year is going to be. I think recently we got to a year after we graduated from the IDS. So I compelled those patients and I did GI mapping. So I did, some of them also do breath testing, but I really wanted to study the gut because we know, depending of what the symptoms are, if you have hypochlorhydria, meaning that you have less acids, you have certain type of bacteria. If you have, different type of motility in your intestine, then you have other type of bacteria. If you have Helicobacter pylori, which out of my almost 30 patients, I found that almost 70% of them has it. Some higher than others. Some I have to treat with, the regular protocol. Some of them I treated with the herbal protocol, which we can go into. But I started studying the dysbiosis that they have and how to get them better. So the first thing I did for the GI mapping, I also studied inflammation. I do the peak test, which is an inflammatory marker, and then I do cortisol because some of the patients are really, really inflamed. And later on, depending on how they, the evolution of their condition is, I started certain minerals and certain vitamins because, a lot of like enzymes, a lot of the enzymes and things that we need to digest our food and have a good motility, like zinc, selenium, magnesium, they're also going to play a role. So what I did is like in my very stubborn patients that I have tried maybe the conventional therapies and even, sometimes lasers. I used to do IPL, which I'm no longer do IPL to rosacea patients. I do more neodymium and YAG, and we'll talk about that later. I started studying them. And so I saw a lot of the patient has H. pylori, and a lot of them have deficiency of Akkermansia. I can say it. So this is a very important microbe that we need to have it in a good balance in our gut because it protects us. So and actually now it's considered an inflammatory marker. So, and I have seen many of my patients with decreased levels of Akkermansia. So that's how I got so interesting and see, okay, this is what's going on. Let's clean them up. Let's leave the oxidation. Let's give them the treatment for 2 weeks. And then after 2 weeks, I started kind of like changing the diet. I do an anti-inflammatory diet. I know there's some studies that said that milk and dairies don't worsen rosacea, but sometimes if the patient has SIBO, they worsen the SIBO with the casein, because the casein and the glutein and all of those increase the sonulin, which is the one that is going to allow our enterocytes or cells in our gut to be together. And because of the casein or gluten or either all those proteins, if they're in the food that we eat, like milk or gluten, the sonulin is going to increase. We're going to have a leaky gut, and then we're going to have probably inflammation and end up having this biosis and probably SIBO.
Yeah, I mean, it's very interesting when you look at SIBO in terms of just how prevalent it is, because some studies have shown that it's up to 50% prevalent in people with rosacea as opposed to way lower in the general population.
Yes.
And then I do like doing the breath testing personally. I do the one that does the three gases, hydrogen, methane, and hydrogen sulfide. Do you build in breath testing into your approach? I noticed that you do gut microbiome testing, which makes a lot of sense to me. Do you incorporate breath testing, or how do
I
you?
started recently doing more because I want to really confirm that the GI mapping is, because depending of the breath, it's different bacteria they're present, and the dysbiosis can perform differently. So, for example, if you have methane, that you have to treat the hypochlorhydria, and you have to give them probably certain antibiotics like rifaximin or neomycin or different enzymes to digest the food, Whereas the hydrogen, if it's elevated, you can use it with oil or other type of antibiotics. So I like to do it, and I'm doing it more recently to be more complete and to see, okay, this patient, if has this profile of bacteria and this biosis, I need to treat it differently. Some of this patient has hypochlorhydria and you need to improve the acid, but I don't give them any vinegar or apple cider vinegar at the beginning, because if you give them fermentation, it's going to be worse for them. So I try to give them an anti-inflammatory diet. I'm trying to kill the bacteria that I don't want to be there. And then I kind of like every 2 weeks, I kind of change a little bit the diet, and I started giving him fiber, a lot of fiber, a lot of omega-3, because omega-3 acts as a prebiotic also and increase the bacteria that we want to be in balance, like the Fusimobacterium or Bacteroides. We want those bacteria not to be too high, any of those, but we want them to be in a balance, because that's going to prevent us to have, a dysbiosis or SIBO later on. And also I give them polyphenols and certain prebiotics, depending of the profile that I wanted to either increase, like the Akkermansia, or decrease the other pathogenics.
What's really interesting about omega-3s is that it's been used for ocular rosacea as well as alternative to doxycycline.
Oh, yeah.
A lot of studies have looked at it for dry eyes and whatnot. So, Martha, I wanted to change the kind of tenor of the conversation, move away from the gut, since we're taking an integrative approach. And can you talk us through what topicals do you use? Anytime we talk integrative, I think people mistakenly will think that means you're moving away from conventional medicine, but I assume you're still incorporating some conventional medicines. What are your topicals of choice? And let's talk about laser therapies too.
No, 100%. There's something that I do a lot of my rosacea patients, but I combine it with the laser. But one thing that I like to do is, like, of course, you need to treat, if you still have Demodex and you have increased Demodex and your skin microbiome also changes, you need to kind of balance topically. So I always use products that have prebiotics or thermal water that kind of like have those minerals to kind of help with the skin microbiome. I use either, topical ivermectin or, metronidazole topical. If I think they're going to be at the beginning, too inflamed, I add that on. And also I try to repair that barrier, because we know that the skin has the fatty acids on the skin, a shorter change instead of the longer change. So you need to help with that, because in rosacea patients, we have sensitive skin and we have a lot of water loss because of the skin barrier. So that's also that you have to, consider that into the whole armamentum. I like also to add some of the oils. I like the rose hip oil or the avocado oil that I introduced to the regimen. especially at night. And I always give them antioxidants. I tell them you need to use an antioxidant, either niacinamide. I love niacinamide for rosacea. I always tell them vitamin C, and I love bakuchiol, which is an antioxidant, but it's a retinol that they can tolerate better.
I think that's also pretty interesting, Martha. And let me just add to one of the topicals, one of the newer agents that we even studied was encapsulated benzoyl peroxide is different than the standard benzoyl peroxide. It seems to be way less irritating. And we found that, it was really interesting on the skin microbiome. A lot of patients have an abundance of staph epidermidis, which normally you think is a good thing. And then they have a decrease in C. acnes, which you think is great for acne, but it turns out actually it's all reversed for rosacea. And so treating it with the encapsulated benzoyl peroxide actually increased C. acnes because now the sebum is starting to produce better lipids. And then staph epi went down. So yeah, regardless, I love the fact that you're incorporating topicals that include some of our standard pharmaceuticals, but also include little extension beyond that. Can we now talk about laser treatment of rosacea? And it's interesting when people think about laser treatment for rosacea, they just think of the kind that's erythematotelangiectatic, not so much the inflammatory papules anymore. But what is your approach on this? How do you use lasers when it comes to rosacea? What lasers do you use? And are there certain subsets that it works better for?
So I love this protocol because I feel like my patients were so happy and they were miserable for so long, and the skin changes. Not only the internal approach, but when you do the lasers on them, it's so I use a platform that has an neodymium YAG and erbium YAG, but in my protocols, what I have like a 3-4 step protocol. The first step, what I do is like anti-inflammatory. It's a neodymium YAG that has different pulses, that has actually in the studies have seen how decrease the vascular growth factors as well as the cytokines, inflammatory cytokines, especially IL-10. And so this has been studied already. And also, that those patients, because they have chronic angiogenesis, they have a lot of vasculature and a lot of like dilated veins. So
What kind of settings are you typically choosing? Obviously, you personalize to each patient, but I'm curious. So this is the first step is ND YAG, and what kind of?
Yeah, I have the Fotona, and the Fotona has a pulse that's called FRAC3 that we call the anti-inflammatory and the collagen producer. So depending of the pulse that you use, I use, the energy is low in this case. I use a 10 joules and zero point 0.6 milliseconds. So it's very low because you just want to decrease inflammation. Then I use what they call Versa, which is a longer pulse, and I use depending, maybe 15 millisecond, 20 millisecond, 25 milliseconds with 140 to 160, 70 joules. And I use a longer pulse for the individual vessels. So I go after individual vessels, especially around the nose, if you have in the cheeks, and the chin is very common that they have thicker vessels as well, because that improves a lot of the erythema and the inflammation. An interesting thing that I do right after the laser, and then I do the papular step, which I'm going after the demodex, because the perifollicular inflammation, we
But you
can
treat the
attack it.
papules, Martha, in step 3. You go after the papules.
Yeah, I do. I
Very
do.
interesting. Please continue.
So what we're treating here is the perifollicular inflammation. And so I use them in different pulses as well. So after that, I use the oxymetazoline topically. And there are studies that say if you use in combination with the laser over time, because this is an alpha androgen adrenal receptor agonist, it's gonna vasoconstrict. But the vasoconstriction is not like 8 hours as the study said. If you use after the laser, the vasoconstriction or the minimization of the vessels can last 6 months. So I started doing this combination, and to me, it's been very effective.
Can you talk more about step 4? So how does that work? You're saying you add that after step 1, 2, and 3, and then it lasts
So
longer.
step 4 for me is a collagen production, because you want to improve the matrix. So there is also in the NDYAG with the FRAC3 that they use in the beginning, but with a higher energy. I use like 36 and zero point 0.3 or 0.6 milliseconds. So in that step, I'm just doing a lot of passes, maybe, my pulses go up to 2,000, 3,000, because I really, really want to improve the collagen production. And then when you see back the patient after even the first sessions, the skin is like more plump, more illuminated. the papules are decreased, the erythema is improved. So I usually typically, depending on the severity, I do 4 to 6 sessions, but after the first one, you already see results.
So Martha, I want to clarify because I just want to be sure I didn't miss something here. So step one is you're doing a faster pulse with FRAC3, which is this kind of intermittent pulsing that they do. Then you go to the Versa, which is a longer pulse,
Right.
right? And then after that, you're targeting the papules.
With the Versa, but I kind of change a little bit. So I do Versa, but I do like 40. I don't do 160. I do
I
like
see. You don't do
40.
160. So you bring down that fluence
Yeah,
much
I bring that
more.
down and I go step by step. I do like 4 to 6
And
passes.
then you said you added the oxymetallazone. Is that like the end of step 3?
Yeah, right before
Got it.
the patient leaves, when we're done, I added on.
Okay, fantastic. And then you do the collagen building because who doesn't want to build collagen, right? We all want to build
Right,
collagen,
right.
which
Yeah,
we know if you have rosacea, you've had some photo damage along the way.
yes.
Martha, this has been absolutely fascinating. You've walked us through, and this is the power of an integrative dermatologist who also knows her lasers really well. You've gone through talking about gut health for rosacea, talking about what kind of foods they're putting in there, making sure you're understanding what the bacteria are down there. And then you're also looking at the topicals. And on top of it, you have this protocol that's developed for a laser therapies to really bring down the vascularity and also prolonged effects of the topical and building collagen. I just don't know who else could do this besides an integrative dermatologist, Hadar. I can't imagine anyone else would have the expertise, to be frankly honest with you.
I could not agree more. In fact, I urge everybody to follow in Martha's steps and maybe consider that there is benefit to seeing the entire patient and come to IDS. Maybe if you're eligible, do the certificate program. Who knows? Maybe one of these days you'll be on the podcast and talk about the way you integrate other things. And, we are out of time, but there were so many other follow-up questions I wanted to ask you, but I thought just let her speak her gospel. So, Martha, thank you so much for joining us and for sharing your expertise, your journey, your ability to reinvent yourself as an integrative dermatologist, which I think is really cool for your sake and for your patients. Thank you.
And then I just want to put a plug in to say Martha was part of the Integrative Dermatology Certificate Program, which is a 9-month program that is developed to do a lot of integrative training and integrative knowledge-based building just designed for dermatologists. We also have the DCIE program, which is for those that are not dermatologists, but physician assistants, nurse practitioners, and those that are really want to learn more about how to take an integrative approach. And finally, Martha, why don't you tell us about your practice so people can find you? And then we'll look forward to the next session with you in the future.
Thank you so much, guys. So I'm in Miami and Coral Gables. I have my Instagram is Viera Martha MD. It's the same as my Facebook. And so I'm here for you guys. Whenever you need me, I'm here for you. Thank you so much.
Hey, Raja, have you heard of the JOID?
Of course. It's the Journal of Integrative Dermatology, an international peer-reviewed open access journal.
That is correct, my friend. The JOID spans multidisciplinary fields represented in integrative dermatology. This includes areas such as conventional treatments and pharmaceuticals, as well as naturopathic medicine, Chinese medicine, and Ayurveda, as well as nutrition and functional medicine.
That's pretty comprehensive. Well, tell us, who benefits from it?
Okay, the JOID unites experts worldwide, from research bench to the clinic, sharing new clinical studies, epidemiological investigations, editorials, case reports, and systematic reviews. So if you want to know the latest and greatest findings in integrative dermatology, this is your journal.
Finally, there's a journal that evaluates and publishes the evidence in integrative dermatology.
Definitely. So stay curious and informed with the JOID, the Journal of Integrative Dermatology.